Hi, welcome to EuroPCR 2025. My name is Tiffany Patterson. I work at St Thomas's Hospital and I'm here with Philippe Généreux from Morristown Medical Center in New Jersey and Nicolas Van Mieghem from Erasmus in Rotterdam. We're going to talk about the emerging indications for TAVI in 2025 and I'm going to go to Philippe Généreux first. So Philippe, tell me, what do you think are the emerging indications for TAVI in 2025?
Oh, thank you so much, Tiffany and Nicolas. It's a pleasure to be with you. So obviously we're going to talk about the severe aortic stenosis, no symptoms, asymptomatic severe AS. There's a lot of trial in the last 5 or 10 years that emerged. We have now 4 randomized trials, the Recovery, the Avatar, the Early TAVR, and Evolve, that all show some superiority to clinical surveillance, so early intervention with either surgical AVR or TAVR seem to be beneficial compared to the statico or watchful waiting, especially in terms of reduction of hospitalization for heart failure for sure, a trend to reduction in mortality, and also a trend to reduction in stroke. So I think very exciting news in this regard. Whether those new trial will be enough to move the guideline into place as a class 1 or class 2 for early intervention remain to be seen, but very exciting field for the patient with severe aortic stenosis. Yeah.
Excellent, thank you so much. And Nicolas, tell me about what you feel are the emerging indications for TAVI.
Well, another emerging indication is moderate aortic stenosis, patients with symptomatic moderate aortic stenosis. And it was a long time coming, but we have published the results of the TAVR UNLOAD randomized controlled trial comparing TAVR for moderate aortic stenosis in patients with heart failure with a reduced ejection fraction and symptoms with moderate aortic stenosis. The trial did not meet its primary endpoint, so we did not see a difference between the two strategies, but that had to do with the progression from aortic stenosis from moderate to severe. And obviously, when a patient is symptomatic and the aortic stenosis is severe, it's a class 1 indication to replace the valve. And that was exactly what was happening. So we were not affecting hard clinical endpoints, but we were affecting the quality of life. So it's clearly visible the moment you replace the valve, the moderate stenotic valve, symptoms improved immediately, and the symptoms in the clinical surveillance arm were only improving once they progressed to severe AS and received the TAVR.
This really is fascinating. And what else? What other emerging indications?
Well, obviously we're going to build on Nicolas' leadership and expand to moderate AS with normal ejection fraction or cardiac evidence of cardiac damage, what we call moderate AS at risk with at-risk feature. And there's 2 trials right now ongoing, the Progress trial and also the Expand 2 trial. So we're going to learn a lot in the next few years, building on the idea of Dr. Van Mieghem. So the other one, which is very exciting, is now we're leaving aortic stenosis. We go for aortic regurgitation, a field that was dominated by surgery. Now we have dedicated device. We have at least 2 platforms that are dedicated for aortic regurgitation with very promising early feasibility data. And now we're entering the phase of randomized trial comparing to surgery, which I think will be extremely exciting for the future as well.
Yeah, and that's exactly what's going on now. There is this, it's called the ARTIST trial, randomizing patients with severe aortic regurgitation at high operative risk to either surgery or TAVR with a dedicated system.
Well, there we have it. You've heard it from the experts, the emerging indications for TAVI in 2025. So upstream indications including severe asymptomatic aortic stenosis and moderate AS with symptoms, and the often neglected aortic regurgitation. Thank you very much for listening.